So again new chapter from your industrial pharmacy, and that is nothing but the parenteral products. We have already completed our pre-formulation, tablet, capsule, suspension, emulsion, suppositories, aerosols. So it's time for another chapter known as the parenteral products. So or sterile products, or they are also known as the injectables. Injectables, sterile products, injectables, sterile products, then your parenteral products, each and everything is same. So all these are the synonyms for sterile preparation, sterile product or injectables or parenteral products. So first, what do you mean by parenteral product? So parenteral product means what? So anything that is given by parenteral means other than intestine. Other than intestine में जो भी लेंगे उसको बोलेंगे parenterals. First of all, what do you mean by parenteral products? So we have seen there are different dosage form like your tablet, solid dosage form, then liquid dosage form, then biphasic dosage forms are also there. So again, parenteral products they have a little bit difference in your as your other dosage form, because in the other dosage form like tablet, capsule, oral suspension, oral emulsion, you don't have to take much care about the microbial load, much care about the toxins. But if you are injecting something inside the body through the your by through bypassing your primary defense system, for example skin. So skin is known as a primary defense system of your body, because what is the role of skin? To protect the internal, whatever internal organs are there or whatever deep tissues are there, so that is protected by your skin. Now if you are using something orally like tablet, capsule, suspension, emulsion and other oral doses, so they need not to be sterile, they need not to be isotonic, they need not to be pyrogen free. So normally जो आपका tablet, capsule, सस्पेंशन, ओरल सॉल्यूशन, ओरल इमल्शन जो भी होता है या फिर जो भी आप टॉपिकली अप्लाई करते हो, तो वो जो फॉर्मुलेशन है उस फॉर्मुलेशन को स्टराइल करने की जरूरत नहीं, स्टरलाइजेशन करने की जरूरत नहीं है. एंड दे दैट प्रिपरेशन शुड आल्सो नॉट टू बी isotonic, that should not, that is not required to be isotonic, that is not required to be free from bacterial endotoxins. But if you are injecting something inside your body by a various route of injections like intradermal, subcutaneous, intramuscular, intrathecal and intra-arterial, intra-articular, there are a lot of sites for injection. So if anything or any solution if you are injecting, so that solution must be free from pyrogen, that solution must be isotonic, that solution must be free from bacterial endotoxins. So that is the main difference between parenteral and other dosage form. So the term parenteral means what? So para means other than, and enteral means intestine. So enteral means enteron or intestine. So parenteral means what? So other than intestine. So these are the dosage form which are injected by some way. They are either administered by intradermal injection or subcutaneous injection or intravenous injection or intramuscular injection. They are injected directly to the internal parts of your body. For example, intraperitoneal injection. So intraperitoneal injection, so what do you mean by intraperitoneal? So intraperitoneal injection means, so those injected directly into the your stomach, that or peritoneum, so that is known as intraperitoneal injection, as you can see. So injection is directly, the formulation is directly injected to a peritoneum or to a stomach, so that is known as intraperitoneum. There are different kind of injection. For example, intradermal, so we have already seen. So injection of introduction or injection of solution or some emulsion or little bit suspension into the layers of skin, that is known as intradermal. So injection of your formulation into below the skin into subcutaneous layer, okay, or subcutaneous tissue, that is known as a subcutaneous injection, okay. Then injection of formulation directly into the vein, it is known as intravenous, okay, intravenous injection. Then intramuscular injection, injection of formulation or injection of drug with solution into the muscle tissue, known as intramuscular. Now each and every kind of injection will differ in the formulation aspect somewhat, ठीक है, कि हर एक इंट्राडर्मल इंजेक्शन का लिए ये चल सकता है, ये नहीं चल सकता है. सबक्यूटेनियस इंजेक्शन के लिए ये पैरामीटर चल सकते हैं, ये नहीं चल सकते. इंट्रावेनस इंजेक्शन के लिए यही पैरामीटर चाहिए, इंट्रामस्कुलर इंजेक्शन के लिए ये थोड़ा बहुत प्लस माइनस चलेगा। ये सब जो भी points of discussion है वो we are going to see those point of discussion. Okay, so parenteral products means what? They are being administered inside your body by various route of injections. Okay, so for example, intradermal injection, subcutaneous injection, intravenous injection, intramuscular injection, transdermal injection, intraperitoneal injection, intracardiac injection, okay, intra-arterial injection, intra-articulate injection, etc. There are intrathecal injection. Okay, so we'll see one by one. रूट फॉर पेरेंटल एडमिनिस्ट्रेशन, कौन कौन से रूट्स है जहां से आप इंजेक्शन ले सकते हो, रूट्स ऑफ, ओके, रूट ऑफ पेरेंटल एडमिनिस्ट्रेशन, देन बाय दिस रूट हाउ मेनी ml of injection can be given, usual volume of injection, type of drugs that is administered, then formulation constraint or formulation characteristics. So first one is the primary parenteral routes. So in the primary parenteral routes, you have small volume parenterals, large volume parenterals. In the primary parenteral routes, you have small volume parenteral, large volume parenteral. So what do you mean by primary parenteral routes? So mostly parenteral products, they are either injected into the either subcutaneous tissue or intramuscular tissue or by intravenous routes. So subcutaneous administration, intramuscular administration, and your intravenous administration. So that is known as the primary parenteral routes. Okay. So for example, if you want to give injection known as a subcutaneous injection. So if you want to inject something subcutaneously, so what should be the volume? Remember, 0.2 to 0.5 to 2 ml. So you cannot inject more than this by subcutaneous route. So what is the limit? This is the limit. Okay, 0.5 to 2 ml. Okay, 0.5 to dash 2 ml. That is the limit. More than this, you cannot inject by subcutaneous route. Subcutaneous means what? Below the skin into subcutaneous layer of, okay, that is known as subcutaneous. So mostly it is used to administer the insulin injection. Subcutaneous route से mostly क्या देते हैं, insulin injection देते हैं, vaccines देते हैं. Then next one is intramuscular. So intramuscular means injection of your formulation into muscle. Okay, there are a lot of muscle sites like thigh muscle, gluteus muscle, then your arm muscle, etc., etc. So we have seen already in the very first lecture of so by using intramuscular route, you can inject in between 0.5 ml to 2 ml normally. In various books they have given 2 ml to 5 ml. Okay, हर एक बुक में उसका अलग अलग दिया है, तो आप इतना याद रखो कि पॉइंट, तो 2 ml से लेके 2 ml से लेके 5 ml तक आप इंट्रामस्कुलर इंजेक्शन दे सकते हो. ठीक है, ऐसा नहीं कि आपने 10 ml सीरीज में भर लिया इंजेक्शन और इंट्रामस्कुलर में दे रहे हो. दैट विल नॉट बी, that is not possible, otherwise a patient will be uncomfortable. So what is the maximum volume of injection that can be given by intramuscular route? So इसके ऊपर क्वेश्चन आ चुके हैं already. Maximum volume that can be injected by subcutaneous route is nothing but the 0.5 to 0.5 ml to 2 ml. By intramuscular route 0.5 to 2 ml. Right? Okay, यहाँ पे इसके 2 ml यहाँ पे दिया है, लेकिन 2 ml से लेके 5 ml तक आता है. 5 ml you can inject in the, so nearly all kind of drug that can be injected by intramuscular route. Now if you want to formulate the subcutaneous injection, okay, then in case of subcutaneous injection, that injection should need not to be isotonic. उसको isotonic होना जरूरी नहीं है. Subcutaneous injection need not to be isotonic. Okay, there is no absolute requirement of isotonic. Now in case of intramuscular injection, again intramuscular injection can be either solution or it can be a suspension or it can be a emulsion. So with the some characteristic, emulsion में भी उसका particle globule size matter करता है, suspension में भी उसका particle size matter करता है. But remember here by intramuscular route you can inject the suspension and emulsion both. By intravenous route you cannot inject the suspension. So injection of suspension may block some fine capillaries. Intravascular. Another primary route, that is primary parenteral route, is intravenous injection. Okay, large volume intravenous parenterals. So I think in GPAT 2019 there was a question: several liters of drug several liters of drug fluid that can be administered by one of the following route of administration. So intravenous was the answer. So several liters means what? So using intravenous route you can inject right from 1 ml up to thousands of ml. 1 ml भी आप सिरिंज अगर है सिरिंज से आप 1 ml 2 ml या 5 ml तक आप डायरेक्टली सिरिंज से इंट्रावेनस में इंजेक्शन दे सकते हो। लेकिन अगर 5 ml से ज़्यादा वॉल्यूम है आपके इंजेक्शन का तो उस टाइम पे क्या करना है आपको? So either you can inject that 5 ml your injection into saline. Okay, so you have to either make a admixture. You have to make a admixture. Once you have to make admixture, जैसे होता है ना कि 250 ml का एक नॉर्मल सलाइन का होता है बॉटल, उसमें वो लगाते हैं, फिर बाद में उसमें अगर 10 ml 20 ml इंजेक्शन है तो वो उसमें मतलब admixture कहते हैं. So if you want to inject 20 ml by intravenous route, then you have to inject that solution into already touched intravenous fluid. So remember several liters of fluid or several liters of volume that can be administered by intravenous route. So एक बार अगर पेशेंट आईसीयू में गया तो उसको एक बार ही इंट्रावेनस में इंट्राकैट डालते हैं और एक बार इंट्राकैट वो सब डाल दिया, कितना भी सलाइन उसके ऊपर चढ़ा सकते हो आप, 1 बॉटल 2 बॉटल 10 बॉटल 15 बॉटल. तो होता है ना कि एक बार एडमिट हुआ है तो 15-20 दिन उसको सलाइन पे ही चलता है. सो लार्ज अमाउंट ऑफ और सेवरल लीटर्स ऑफ वाटर, several liters of fluid with drug that can be administered by intravenous route. Remember, nearly all kind of drug, okay, nearly all kind of drug classes that can be administered by intravenous route. Now, in case of intravenous, only solutions, okay, only solutions and emulsions. Solutions and emulsion. Emulsion should have a global size within a range that only can be administered by intravenous route. यहाँ पे अगर सस्पेंशन देंगे तो वहाँ पे जो स्मॉल कैपिलरीज होते हैं वो ऑक्लूड होने का चांसेस है, दैट विल बी ऑक्लूडेड और so then now this was a primary parenteral routes. So now other parenteral routes, for example, first one is the intra arterial route. इंट्रा आर्टेरियल आर्टरी जो होता है आपका आर्टरीज ब्लड वेसल. इंट्रा आर्टेरियल मतलब क्या? सो यू हैव टू इंजेक्ट योर ड्रग सॉल्यूशन इनटू artery, directly into artery. That is known as intra arterial, directly into the artery for immediate action. For immediate action you can inject up to 2 ml to 20 ml. You can inject 2 to 20 ml in the artery. उससे ज़्यादा अगर आर्टरी में इंजेक्ट करेंगे तो डायरेक्टली वो दैट ड्रग कैन प्रूव कार्डियोटॉक्सिक. सो इंट्रा आर्टेरियल इंजेक्शन अगेन इट हैज अ लिमिटेड volume. So you can inject up to 20 ml, 2 to 20 ml, that's it. Okay, now what kind of drug generally they are given by intra arterial route? So radio opaque media. So radio opaque media means what? So they are known as diagnostic agent. जैसे डायग्नोसिस के लिए कोई इंजेक्शन दे रहे हैं सेमिथिलिन ब्लू टू डिटरमाइन द वॉल्यूम, सो दैट कैन बी गिवन बाय इंट्रा arterial route. For diagnosis or radio opaque media, then anti-cancer drugs, certain antibiotics, they are also given by intra-arterial route. Intra-arterial मतलब directly you have to inject into artery. So 2 to 20 ml. And here again solutions and some emulsion. Some emulsion means in that case in the emulsion you have to control the globule size. Now next one is intrathecal. Intrathecal. Okay, यहाँ पे दिख रहा है. Are you able to see the screen properly? Now intrathecal or intraspinal, that means you have to inject a solution inside the spinal cord into subarachnoid space of spinal cord. So now maximum amount of volume that can be injected is 1 to 4 ml. It is intrathecal or intraspinal. Intrathecal or intraspinal. So mostly local anesthetic drugs, analgesic drugs, neurolytic drugs, they are injected and they must be isotonic with the CSF. They must be isotonic with the blood body fluid. Okay. Now again intraperitoneal, intrathecal and intraperitoneal, there is only little bit difference. So in case of intraperitoneal, so injection is injected in the outer covering of your outer layer, okay, into the epidural space near to the spinal cord. Okay, it is not injected into the spinal cord, so it is injected near to the epidural space. Epidural is outer space or epidural space near to the spinal cord. Now you can inject up to 30 ml. By this intradural injection you can inject up to 6 to 30 ml volume of injection. Mostly local anesthetic drugs, narcotic, sorry, narcotic analgesic drugs, okay, steroids, they are injected by intraperitoneal route. Again, must be isotonic and isobaric. So must have same isotonic tonicity as that of the cerebrospinal fluid and must have same osmotic pressure as that of the. Then next is nothing but the intracisternal route. Intracisternal. What is intracisternal? So intracisternal means directly you have to inject the drug in the region of brain between cerebellum and medulla oblongata. So again, only small amount of drug that can be injected. That is a 2 to यहाँ पे कुछ वॉल्यूम नहीं दिया है उनका, ठीक है. So it is seldomly used. ब्रेन में कोई इंजेक्शन कभी देता नहीं जाता. Then next one is intra articular injection. Intra articular means inside the joint. Intra articular means inside the joint. Now you can inject about 2 to 20 ml in the joint for local action in case of rheumatoid arthritis or osteoarthritis. So directly into the joint, usually for local delivery of drugs, for example steroid drug, okay, then anti-inflammatory drugs, etc. So morphine, local anesthetics, then steroids and NSAIDs, they are injected into joints directly, known as intra-articular injection. Okay, they must be isotonic again. Then next one is the intracardial injection. So if you want to inject directly into the heart, so intracardial injection कब देते हैं याद रखो, in case of heart failure. अगर heart fail हुआ है आपका, at that time only intracardial injection is given, and the drug most commonly used is a noradrenaline. Direct when injection is directly given into the cardiac tissue or heart, it is known as an intracardiac injection. And when the life-threatening condition is there, that means heart failure, etc. At that time you have to inject the noradrenaline, epinephrine, or dopamine. So cardiotonic drugs mostly and calcium, they are given by intracardiac injection. What is the volume of intracardiac injection? So it is around 0.2 to 1 ml, 0.2 to 1, 0.2 to 1 ml injection that can be injected by intracardiac route. Now intrapleural, pleural means what? Pleural cavity. So pleura is related with the your lungs. Okay, so directly injection is given into the pleural cavity of lung. Okay, and also this can be used to withdraw the pleural fluid from the lungs for diagnosis or examination. So what is the amount? 2 to 30 ml. Mostly these kind of drugs are used like local anesthetic, narcotic, and antibacterial. Now last, diagnostics testing. For diagnostic testing purpose, intradermal injection is given. So intradermal means in the dermis, that is a maximum 0.05 ml. It is used for the diagnosis test. For example, to check the sensitivity of your antibiotic, it should be isotonic again. So these are there are different routes, parenteral routes. Okay, so first parenteral route is known as a primary parenteral routes and other parenteral routes we have seen in the detail. ये वॉल्यूम के ऊपर क्वेश्चन आता है कभी कोई कि इंट्रामस्कुलर से कितना वॉल्यूम दे सकते हो, इंट्रावेनस से कितना दे सकते हो, सबक्यूटेनियसली कितना दे सकते हो. हाँ सर, पांडरे सर बोलते हैं. हाँ बोलो ना सर. What is sterile products? So again, sterile products are the dosage form or therapeutic agent. They are free from any viable form of microorganism. Sterile मतलब क्या है? Sterile मतलब उसमें कोई viability नहीं, उसमें कोई visible या फिर उसमें कोई living cell नहीं. Sterile products, they are dosage form or therapeutic dosage form with the therapeutic agent. They are totally free from any form of viable microorganism. So there should not be a single living cell. There are different kinds of your parenteral formulation, or there are different kind of your sterile formulation like parenteral injections. Okay, then ophthalmic products are there. Then irrigating solution are there. Okay, so remember there are different kind of sterile products like parenteral products, mostly injections. So intradermal injection, intravenous injection, intramuscular, intracardiac, etc. So all kind of injection they are parenteral. Then ophthalmic product, so the solution or the drug that is being used in the eyes, okay, in the conjunctival sac. So eye drops and all that, they are known as ophthalmic product. Then irrigating solution means what? Okay, so if you want to wash a particular organ wash करने के लिए, या फिर irrigation solution means these are the solution which are used for irrigating the organs, that means washing the organs. जैसे आपका किडनी का इरिगेशन करना है या फिर आपका किसी भी इंटरनल ऑर्गन का जैसे स्टमक का. So all the irrigating solution they should be isotonic and free from microbial, okay, any form of viable microorganism, because they have circumvented highly efficient first line body defense, that is nothing but the skin and mucous membrane. Therefore they must be free from microbial contamination and toxic component as well, and should possess exceptionally high level of purity. इसका मैं हिंदी में बोलता हूँ आपको, ठीक है, कि जैसे स्टेराइल प्रोडक्ट होते हैं आपके, वो कहाँ पे यूज करना है आपको. एक तो आपको इंजेक्शन देना है उसके बॉडी के अंदर बाय वेरियस रूट, या फिर उसको आपके आइज में यूज करना है एज अ आई ड्रॉप, या फिर उसको आपके कोई इंटरनल ऑर्गन है उसको वॉश करने के लिए यूज करना है. सो दैट्स व्हाई यू हैव टू यूज इनसाइड द बॉडी, ओके, एंड डायरेक्टली बाय क्रॉसिंग योर फर्स्ट लाइन डिफेंस ऑफ बॉडी, दैट इज नथिंग बट द स्किन एंड म्यूकस मेम्ब्रेन. तो स्किन एंड म्यूकस मेम्ब्रेन के अंदर ही इंजेक्शन देते हो, उसके बाहर नहीं देते. तो क्या होना चाहिए उस प्रोडक्ट को. सो दे शुड हैव एक्सेप्शनल हाई लेवल ऑफ प्योरिटी, दे शुड बी फ्री फ्रॉम ऑल काइंड ऑफ माइक्रोऑर्गेनिज्म, they should be free from your pyrogens, then endotoxins, and they should be isotonic with the body fluid. Okay, so because they have circumvented the highly efficient line of your body defense and the skin and mucous membrane, and therefore they must be free from microbial contamination and toxic component, as well as they should have exceptionally high level of purity. Now parenteral preparation may be given by various route, as I have told, intravenous, interspinal, intermuscular, subcutaneous, interdermal, etc. etc. Remember one thing over here, already they have asked the question on this. Bioavailability bioavailability is 100%. Bioavailability is 100% when a drug is given by intravenous route. क्वेश्चन ऑलरेडी आ चुका है इसके ऊपर, एक दो तीन बार हो चुका है, इसलिए मैं ज़्यादा नहीं. Bioavailability is the 100% when drug is given by intravenous route. Now intravenous, intraspinal preparation, they are rarely formulated with a non-aqueous solution. मतलब क्या कि इंट्रावेनस इंजेक्शन जो होते हैं या फिर इंट्रास्पाइनल इंजेक्शन जो होते हैं, तो मोस्टली वो क्या करते हैं कि सॉल्यूशन ही रहते हैं, वो ये ऐसे नहीं रहेंगे कि सॉल्यूशन रहेंगे विद एक्वेस वेहिकल. सो मोस्टली इंट्रावेनस एंड इंट्रास्पाइनल इंजेक्शन दे आर रेयरली विथ नॉन एक्वेस. यहाँ पे वाटर ही बेस यूज करना है, वाटर इज यूज्ड एज अ व्हीकल फॉर मोस्ट ऑफ द इंट्रावेनस एंड इंट्रास्पाइनल इंजेक्शन. तो यहाँ पे दूसरा कोई सॉल्वेंट यूज नहीं करना, जैसे ग्लिसरीन होता है, प्रोपिलीन ग्लाइकोल होता है, या फिर अदर वेजिटेबल ऑयल होता है. सो दैट मीन्स इंट्रावेनस एंड इंट्रास्पाइनल इंजेक्शन दे आर मोस्टली prepared by aqueous solution. Okay, they are mostly prepared as aqueous solution. Then next point we'll see. We are going to see only important points for your GPAT Niper DI Pharmacist from this chapter, because this chapter is a very huge chapter. बहुत बड़ा चैप्टर होता है आपका, उसमें जितना इम्पोर्टेंट है उतना ही लूंगा, ज़्यादा बहुत ज़्यादा इन्फॉर्मेशन देके कोई फायदा नहीं, because that is not, they are not going to ask you anything. Now preparation given by intramuscular or subcutaneous route, okay, or intradermal route. They can be administered as either solution, suspension, or emulsion, or even some solid pellets that can be transplanted subcutaneously or intramuscular. मतलब बाकी जो इंजेक्शन है इंट्रावेनस और इंटरस्पाइनल छोड़ के, जैसे आपका सबक्यूटेनियस हो गया, या फिर आपका इंट्राडर्मल हो गया, या फिर इंटरमस्कुलर हो गया. So using those kind of route you can inject solution also, suspension also, emulsion also, and pellets also. Pellets inject नहीं करते हैं, pellet transplant करते हैं. For example, suppose some controlled release pellet is there, so that will release drug for at least 6 months. That can be transplanted by making a small incision or by making a small surgery to your skin. That is known as a, so that can also be used. That is comes under parenteral one. Then we'll see the next point. So formulation consideration of your parenteral product, it is very very important. Again this part you can see GPAT के लिए जो ऐसे क्वेश्चन आएंगे वो पार्ट चालू हो चुका है, पहले इसमें GPAT का क्वेश्चन ज़्यादा आता नहीं है. So now whatever part we are going to see, from that part you can expect the questions. Now formulation consideration for parenteral product. Parenteral injections में कौन से formulation consideration है. So first आपका होना चाहिए API. पहला तो आपका ड्रग है, so active pharmaceutical ingredient. So API should be very very pure, in a very pure form, and it should be free of any contamination. It should be free It should be free of any microbial load. It should be withstand with the high temperature pressure, because after all you are going to sterilize the product either using dry heat or moist heat. So it should not be liable for hydrolysis, oxidation, etc. etc. That are the ideal qualities of your drug candidate for parenteral formulation. Okay, that is again. Then second part is nothing but the vehicle. Vehicle means vehicle means whatever solvent or liquid you are using for making injection. So vehicle either may be aqueous vehicle or non aqueous vehicle. Aqueous vehicle मतलब क्या, water based vehicle. Okay, so in a aqueous vehicle you have different kind of injection, like water for injection, sterile water for injection, bacteriostatic water for injection. There are a lot of water for injections we are going to see in the upcoming slide, and in that you have water as a vehicle. Then non-aqueous vehicle means other than water, okay, or water miscible solvents like dioxin, dimethylastamide, N-methyl lactamide, then butylene glycol, polyethylene glycol like PG 600, PG 800, then glycerin, ethyl alcohol, etc. etc. So water miscible solvent, they comes under non-aqueous solvent. Then third is nothing but the water miscible solvent. So first one is a aqueous solvent, मतलब प्योर वाटर रहेगा उसमें. नॉन एक्वियस मतलब यहाँ पे वाटर नहीं रहेगा लेकिन वाटर मिसिबल सॉल्वेंट रहेंगे. एंड लास्टली आपका रहेगा फिक्स्ड ऑयल्स. सो थर्ड व्हीकल इज अ फिक्स्ड ऑयल्स. सो फर्स्ट व्हीकल क्या है आपका, एक्वियस व्हीकल. सेकंड है आपका नॉन एक्वियस व्हीकल इन दैट वाटर मिसिबल. ओके, फर्स्ट इज अ एक्वियस व्हीकल, second is nothing but the non-aqueous vehicle, and third one is nothing but the fixed oil. Third one is nothing but fixed oil. Fixed oil means in that case you have ethyl oleate, isopropyl myristate, benzyl benzoate, RHS oil, etc. So most commonly used non-aqueous solvent. इसके ऊपर क्वेश्चन आ सकता है. So most commonly used non-aqueous solvent in the parenteral formulation as a vehicle: polyethylene glycol and polyethylene glycol and propylene glycol. Polyethylene glycol, propylene glycol, and fixed oil. Most commonly used non-aqueous. Non-aqueous. So your drug should have certain properties. Okay. Then after that, your vehicle should have certain properties. Okay. Vehicle के ऊपर पूरा एक lecture हो सकता है. Then your formulation consideration. Third formulation consideration is a pyrogen free. So your injection must be pyrogen free. So what are the pyrogens? So okay, so your parenteral preparation and vehicle used for the making injection, so both should be free from pyrogens. Now what are the pyrogens? Pyrogens are nothing but they are the metabolic product of your bacteria. So they are the metabolic product of bacteria, particularly they are lipopolysaccharide. Okay, remember, they are lipopolysaccharide, and sometimes they may be either proteins may be there, they may be either peptides. So pyrogens are the metabolic product of your bacteria, and in chemically they are lipopolysaccharides. इसके ऊपर क्वेश्चन आता जाता है. Chemically they are lipopolysaccharide, but they might be sometimes proteins in nature or peptide in nature. Remember, gram negative bacteria produces most potent toxin known as endotoxin. ग्राम नेगेटिव बैक्टीरिया जो होते हैं वो क्या करेंगे, एक टॉक्सिन प्रोड्यूस करते हैं, वो बहुत ही पोटेंट होता है. So that is known as endotoxin. That's why endotoxin test is there. Endotoxin limit is there for vehicle as well as your injection. So remember over here they can ask the question, what do you mean by pyrogens? Pyrogens are nothing but the metabolic product of your bacteria. Chemically they are lipopolysaccharide, or they might be sometimes peptides. Okay, and if these pyrogens are present in your vehicle and if you inject that injection or vehicle, so what will happen, they will induce the pyrexia. Pyrexia means increase in the body temperature. तो ये देखो, कभी कभी इंजेक्शन लेते हो आप, तो इंजेक्शन लेने के बाद में क्या होता है कि आपको बुखार आता है. तो वो बुखार क्यों आता है? बिकॉज दैट इंजेक्शन माइट समटाइम कंसिस्ट ऑफ pyrogens. It must be totally free. Nowadays it is not possible. पहले जमाने में होता था कि इंजेक्शन लेने के बाद बुखार आता. So your parenteral injection should be free from any contamination, or they should free from any viable cell. They should be free from pyrogens, that is a lipopolysaccharide or peptides. Okay, remember, gram negative bacteria produces most potent toxins known as endotoxins. Now what will they do if they are present in your formulation? आपके इंजेक्शन में अगर पायरोजन है और वो इंजेक्शन आपने पेशेंट को दे दिया, तो क्या होगा, So they increases the body temperature, they causes the chills means ठंडी बढ़, cutaneous vasodilation, blood vessel जो cutaneous blood vessel है उसको dilate कर देंगे, they increases the arterial blood pressure. Okay, so these are the consequences of your pyrogen, they are present in the formulation. Now what is the source of contamination of this pyrogen? So source of contamination are nothing but the water, whatever water you are using for making water for injection or for vehicle, so that water may consist of pyrogen, or contaminated solids may be have there, and containers may also be have some bacteria. So that's why, as it is question was there in the GPAT 2020, what was the question? This line, this whole line, container may be rendered pyrogen free by adequate cleaning and heating at 210 degrees Celsius for 3 to 4 hours. So there was this question in GPAT 2019. 2019 में क्वेश्चन था, a container may be rendered pyrogen free by heating at 210 degrees Celsius for 3 to 4 hours, or it can be rendered pyrogen free by heating 650 degrees Celsius for 60 seconds. सो याद रखो पायरोजन फ्री कैसे करेंगे कंटेनर का, कंटेनर में पायरोजन का कैसे एलिमिनेट करेंगे. सो कंटेनर्स में बी रेंडर्ड पायरोजन फ्री बाय हीटिंग एट, फर्स्ट देयर आर टू वे, फर्स्ट बाय हीटिंग एट 210 डिग्री सेल्सियस फॉर 3 to 4 hours. ठीक है, 210 डिग्री सेल्सियस फॉर हीटिंग 3 to 4 hours, और बाय हीटिंग द कंटेनर at 650 degrees Celsius for 60 seconds. However, autoclaving temperature does not destroy the pyrogen during normal cycle. कि normal जो cycle होता है autoclaving का 121 डिग्री सेल्सियस और 15 pound pressure for 20 minutes है ना. नॉर्मली ऑटोक्लेव का क्या होता है कि 121 डिग्री सेल्सियस 15 lbs pressure and 20 minutes. So that cycle will not eliminate or will not destroy pyrogens. But if you modify that cycle, there are different holding temperature that can remove pyrogen. But normally autoclave will not remove the pyrogen. Now they also can be removed by selective adsorption and selective solvent extraction. So there are different methods for removing the pyrogen. First one is a from container. Container can be rendered pyrogen free by heating at 210 degrees Celsius for 3-4 hours, or 650 degrees Celsius for 60 seconds. Okay, or by selective adsorption method and by selective solvent extraction method. So last two methods they are not. Then solute or drug, तो आपका ड्रग कैसे होना चाहिए फॉर्मुलेशन के लिए? So it must have high purity, it must be free from any contamination or any microorganism, it must be stable. Now added substances, so these are the formulation concentration. तो आपको फॉर्मुलेशन मतलब इंजेक्शन बनाना है, उसके लिए क्या क्या लगेगा? आपको ड्रग लगेगा, आपको व्हीकल लगेगा, ठीक है, आपको एडजुवेंट लगेगी, ठीक है. ड्रग कैसा होना चाहिए? फ्री होना चाहिए, कंटेमिनेशन नहीं होना चाहिए उसमें, वो प्योर होना चाहिए. व्हीकल कैसे होना चाहिए? व्हीकल के बारे में पूरा देखा है आपने, कौन से होती है, तो पायरोजन फ्री होना चाहिए, पायरोजन के बारे में पूरा देखा है क्या होते हैं, कैसे रिमूव करना है, ठीक है. तो उसके बाद नाउ एडेड सब्सटेंसेस. नाउ इन इंजेक्शन along with your drug, along with your vehicle, you have different added substances or different excipients. Okay, so solubility enhancer to increase the solubility of poorly soluble drug, okay, by using co-solvent and all that. Then antioxidant to prevent the degradation of your drug. Then chelating agent, okay. Then buffers to adjust the pH of your injection. Then tonicity contributor means to make your injection isotonic. Sometimes antibacterial drug. So antibacterial drug means preservative, antifungal drug, antibacterial agent or antifungal agent means preservative. Now preservative they are only added in the multi dose container, ठीक है. सिंगल डोज कंटेनर में इसका एडिशन नहीं होता है, लार्ज वॉल्यूम पेरेंटरल में भी आपका एंटीबैक्टीरियल एजेंट और प्रिजर्वेटिव नहीं रहता. तो इसके ऊपर भी क्वेश्चन आया है, बाद में इसके भी बारे में और एक बार बोलूंगा. तो यहाँ पे भी याद रखो, प्रिजर्वेटिव आर नॉट एडेड इन द लार्ज वॉल्यूम पेरेंटरल्स और सिंगल डोज कंटेनर. अगर कोई सिंगल डोज कंटेनर है, जैसे आपका एम्प्यूल हो गया, एम्प्यूल क्या है? सिंगल डोज कंटेनर. जैसे आपका इंट्रावेनस फ्लूइड हो गया, जैसे डीएनएस, आरएल, रिंगर्स लैक्टेट सॉल्यूशन 1 लीटर का, तो वो क्या है? सिंगल डोज है. एक बार उसको परचेस किया, एक बार उसको ओपन किया, पूरा पूरा लगाना है. अगर ऐसा नहीं कि आप लगाओगे हाफ एन आवर में, बाद में फिर से लगोगे, उसको फेंक देना है. तो इन केस ऑफ सिंगल यूज कंटेनर और सिंगल यूज इंजेक्शन and small, okay, so in case of single use container preservative they are not used. Okay, हाँ yeah, obviously in case of multi-dose container like vials, वायल में कैसा होता है कि यहाँ पे एक वायल में 30 ml या 50 ml का सोल्यूशन होता है इंजेक्शन का। उसमें क्या है कि आपको 2 ml लेके इंजेक्ट करना है पेशेंट को, 2 ml लेके दूसरे पेशेंट को इंजेक्ट करना है, 3 ml लेके तीसरे पेशेंट को इंजेक्ट करना है. So in that case what happens during multiple withdrawal of dose, so what happens, there might be a chance of contamination. So that's why vials will have preservative. Okay, but single dose container like ampoules and multi dose single dose container like ampoules and your large volume parenteral, they don't require any preservative, they are terminally sterilized dosage forms. Okay, remember इसके ऊपर क्वेश्चन आ चुका है, ठीक है, यहाँ पे लिखा है, मैंने बोला भी है. So antibacterial agent are not added in the single dose container and large volume parenterals. Okay, they only added in the multi dose container like vials. Again, very important part, water for injection and sterile water for injection USP. Okay, वाटर फॉर इंजेक्शन किसको बोलेंगे, स्टेराइल वाटर फॉर इंजेक्शन किसको बोलेंगे, उसका स्पेसिफिकेशंस क्या है एज पर यूनाइटेड स्टेट फार्माकोपिया. इसके ऊपर क्वेश्चन आता है. नाउ पैरामीटर, फर्स्ट पैरामीटर, second one is nothing but the water for injection WFI and sterile water for injection SWFI. So now remember, so there are specifications of your water for injection and sterile water for injection, and in the GPAT exam, Niper exam, they used to ask what is the pH of water for injection and sterile water for injection. So pH range should be between 5 to 7. ठीक है, उसका pH कितना होना चाहिए, 5 to 7 दोनों का भी. ठीक है. Now next one is a conductivity. Now remember there was a as it is question, इसके ऊपर कम से कम 3 बार क्वेश्चन आया. So purity of water can be checked by, so that is the conductivity. Purity of water चेक करते हैं. So purity of water is checked by conductivity method. बोलता हूँ मैं कैसे. For example, if your water has a सॉलिड कंटेंट, आपके वाटर में अगर कोई सॉलिड है जैसे सॉल्ट वगैरह, सो व्हाट विल हैपन, अगर सॉल्ट है तो सॉल्ट दे आर गुड कंडक्टर ऑफ इलेक्ट्रिसिटी, so conductivity of water will be increased, so that you can conclude that there is a higher conductivity in this water. That means there is a lot of dissolved salt in the water. Okay, so conductivity is the very specific method to check the purity of your water. Okay, conductivity, what is the conductivity limit for your sterile water for injection and water for injection. Okay, again it is very important. So conductivity means purity of water may be expressed on the scale of conductance, resistance, then ionic content. वाटर का जो प्योरिटी होता है वो कैसे डिनोट करेंगे, प्योरिटी ऑफ वाटर कैन बी चेक्ड बाय आइदर कंडक्टेंस, दैट इज कंडक्टिविटी, रेजिस्टेंस, again conductivity, and ionic content. For water for injection and water for injection and sterile water for injection, what is the limit for conductivity, 1.3 microsecond per centimeter, ये लिमिट होता है, याद रखो. इसके ऊपर भी क्वेश्चन आ चुका है, व्हाट इज द आइडियली वाटर फॉर इंजेक्शन और sterile water for injection or vehicle used for aqueous vehicle used for parenteral preparation should have conductivity in a range of, okay, ऐसा पूछते हैं. So all the sterile water for injection or water for injection both should have conductivity that is 1.3 microsecond per second. Now it can be measured by either conductance. Okay, so water for injection should not have conductance more than 1 micro ohm. Different units are there. It should not have resistance more than 1 mega ohm, and it should not have more than 0.1 ppm of NaCl. ठीक है, आयनिक कंटेंट ये ज्यादा होगा, सोडियम क्लोराइड तो उसका कंडक्टिविटी क्या होगा, ज्यादा रहेगा. सो अप्रोक्सीमेटली 0.1 ppm NaCl. These are the specifications of water for injection. यहाँ पे इसके ऊपर मैं एक बार बोलता हूँ आपको, क्योंकि इसके ऊपर क्वेश्चन आता जाता है. सो कंडक्टिविटी ऑफ वाटर फॉर इंजेक्शन एंड स्टेराइल वाटर फॉर इंजेक्शन. सो कंडक्टिविटी क्या होना चाहिए, 1.3 माइक्रोसेकंड पर सेंटीमीटर. वाटर फॉर इंजेक्शन का कंडक्टिविटी भी मेजर कर सकते हैं, कंडक्टेंस मेजर कर सकते हैं. कंडक्टेंस कितना होना चाहिए, नॉट मोर देन 1 माइक्रोमो, एंड रेजिस्टेंस कितना होना चाहिए, नॉट मोर देन 1 मेगोम. देन आयनिक कंटेंट शुड बी अप्रोक्सीमेटली not more than 0.1 ppm. Now water for injection and sterile water for injection. Water for injection क्या है, ये प्रिपरेशन का मेथड अलग रहता है वाटर फॉर इंजेक्शन का. इट इज नॉट स्टेराइल. ओके, इट इज नॉट स्टेराइल. एंड स्टेराइल वाटर फॉर इंजेक्शन इट इज मेड स्टेराइल. नाउ सॉलिड कंटेंट ऑफ वाटर, GPAT 2021 में भी क्वेश्चन है. सॉलिड कंटेंट ऑफ वाटर इट इज मेजर्ड बाय evaporating the water to a dryness at 104 डिग्री सेल्सियस. वाटर लेना है, उसको 104 डिग्री के ऊपर हीट करके उसको पूरा इवोपरेट कर देना है। ठीक है, लेना है मतलब ऐसे ही रैंडमली नहीं, लेते समय आपको वेट करना है उसका। So you have to pre-wade, you have to take pre-wade water, and after that you have to evaporate to dryness, and after that you have to again reweigh. So what will have, the residue remained, okay, so that is nothing but the solid content कि अगर वाटर को इवापोरेट कर देंगे उसके नीचे क्या रहेगा, जो सॉलिड कंटेंट रहेगा। व्हाट इज द लिमिट फॉर सॉलिड कंटेंट ऑफ वाटर फॉर इंजेक्शन, दैट इज अ 10 ppm। कम से कम 2-3 बार क्वेश्चन आ चुका है, ठीक है, इन वेरियस काइंड ऑफ एग्जाम्स। सो लिमिट फॉर वाटर कंटेंट, लिमिट फॉर सॉलिड कंटेंट इन द वाटर फॉर इंजेक्शन नॉट मोर देन 10 ppm। नाउ इन केस ऑफ वाटर स्टेराइल वाटर फॉर इंजेक्शन, तो यहाँ पे देखो वाटर फॉर इंजेक्शन के लिए 10 ppm लिमिट है, इससे ज्यादा नहीं होना चाहिए सॉलिड कंटेंट। वाटर, ओके, स्टेराइल वाटर फॉर इंजेक्शन के लिए होता है आपका 20 to 40 ppm। आप बोलेंगे सर ये स्टेराइल है, इसका तो इससे भी कम होना चाहिए। रिमेंबर द सॉलिड कंटेंट ऑफ वाटर फॉर इंजेक्शन इज नथिंग बट द 10 ppm, लिमिट इज द 10 ppm एंड लिमिट फॉर स्टेराइल वाटर फॉर इंजेक्शन इज 20 to 40 ppm। तो होता क्या है कि जब स्टरलाइज करते हो वाटर को, so what happens, you are taking water in some kind of container for sterilization, right? So suppose that you are taking water in the glass container, what will happen, so glass will release the solid during the sterilization process, during the heating process। जब आप उसको हीट करते हो तो उसमें क्या होता है, और सॉलिड लीक होता है, लीच होता है। so more solid content is permitted in the sterile water for injection as compared to water for injection because there is a leaching of solid during sterilization process from the vessel। this is the reason। कम से कम 3 बार क्वेश्चन इसके ऊपर आ चुका है। You have to remember now endotoxin limit, next one is the endotoxin limit। so what is the endotoxin limit for your water for injection, that is nothing but the 0.25 endotoxin unit per ml। 1 ml में 0.25 endotoxin unit से ज़्यादा नहीं होना चाहिए। then what is limit for your sterile water for injection, same 0.25 international sorry 0.25 endotoxin unit per, then pyrogens। so water for injection not required pyrogen free। water for injection में क्या है, so it is not pyrogen free। remember question आता है what is the main difference between sterile water for injection and water for injection। so water for injection did not to be pyrogen free, sterile water for injection must be pyrogen free। sterile water for injection जो है pyrogen free होता है, इसके ऊपर भी क्वेश्चन आता है what is the difference between वाटर फॉर इंजेक्शन स्टेराइल वाटर। तो मोस्टली दो ही डिफरेंस होता है, कौन सा, फर्स्ट वन इज अ सॉलिड कंटेंट एंड सेकंड वन इज अ पायरोजन। नाउ वाटर फॉर इंजेक्शन मस्ट बी हेल्ड अंडर रूम टेम्परेचर, ओके, वाटर फॉर इंजेक्शन मस्ट नॉट बी हेल्ड अंडर रूम टेम्परेचर फॉर मोर देन 24 आवर्स बिफोर इट इज यूज्ड। तो मतलब अगर वाटर फॉर इंजेक्शन आपने प्रिपेयर किया है so you have to use that water for injection immediately for formulation। अगर वाटर फॉर इंजेक्शन आपने उसको ही vehicle लेना है, if you want to use water for injection as a vehicle, then what you have to prepare water for injection immediately and you have to use water for injection immediately, okay। so it should not be stored under room temperature। रूम टेम्परेचर के ऊपर स्टोर नहीं करना है, अगर स्टोर करेंगे तो उसमें कंटेमिनेशन हो जाएगा, ओके। अगर आपको स्टोर करना है तो क्या कंडीशन है फिर, so either it can be stored at a temperature less than 5 degrees Celsius or it can be stored at the temperature more than 80 डिग्री सेल्सियस। ठीक है, अगर आपको वाटर फॉर इंजेक्शन स्टोर करना है तो 5 डिग्री सेल्सियस से कम टेम्परेचर यूज करो, उसके ऊपर स्टोर करो, या फिर 80 डिग्री सेल्सियस के ऊपर स्टोर करो, देन ओनली कैन स्टोर दैट। नाउ वाटर मोनोग्राफ ऑफ यूएस फार्माकोपिया, different types of waters available in the US pharmacopoeia as per the US pharmacopoeia। So types of water, as I have told you, there are different kind of water, there are different terms for water। what is purified water, what is water for injection, what is potable water, what is sterile water for injection, what is a bacteriostatic water for injection, what is a sterile water for irrigation, what is sterile water for inhalation, water for hemolysis, etc etc। तो इसको याद रखो, what is meant by potable water। potable में water means what, so if water is suitable for drinking, if water is suitable for drinking, that is known as a potable water। then after that there is another term known as a purified water। purified water किसको बोलेंगे, so purified water it is made by distillation and ion exchange। so distillation करेंगे, ion exchange करेंगे तब आपको purified water मिलेगा। and what is the use of this purified water, so it is used as a pharmaceutical solvent। जैसे आपको सिरप बनाना है तो you have to use purified water, अगर आपको इमल्शन बनाना है purified water, सस्पेंशन बनाना है purified water। So that is purified water. Purified water. Now next is water for ingestion. Now water for ingestion is made by distillation and reverse osmosis. Question as it is आ चुका है. Water for ingestion is made by following distillation and reverse osmosis. So water for ingestion is made. Am I audible you clearly? आवाज येते सगळ्यांना? आवाज येत आहे का? So water for ingestion is made by distillation and reverse osmosis. Limit for endotoxin we have already seen 0.25 endotoxin unit per ml, not more than. ये सब के लिए मैक्सिमम सेम ही होता है थोड़ा बहुत. Now water for ingestion must be sterile. It must be sterile and it must be used within 24 hours. अगर आपने उसको प्रिपेयर किया तो you have to use within 24 hours. If you want to store this water, so you can store either less than 5 degrees Celsius or more than 80 degrees Celsius. Terminally sterilized parenteral. So conditions बहुत ही important है याद रखो. Now next one is a sterile water for injection. So it is again prepared by distillation and reverse osmosis. So endotoxin limit क्या है? Endotoxin limit 0.25 endotoxin unit per ml. So sterile water for injection is used for single dose container and also used for reconstitution of sterile solid. Reconstitution of sterile solid मतलब क्या? कुछ इंजेक्शन जो होते हैं वहाँ पे लिक्विड इंजेक्शन नहीं होते, वो क्या है उसमें से पाउडर होता है. सम इंजेक्शन विल हैव ओनली फाइनल पाउडर ब्लेंड, जैसे आपका फ्रीज ड्राइड इंजेक्शन, फ्रीज ड्राइड प्रोडक्ट, तो वहाँ पे सिर्फ पाउडर रहेगा उसमें. तो आपको इंजेक्ट कैसे करना है? पाउडर तो इंजेक्ट नहीं कर सकते. सो अलॉन्ग विद दैट पाउडर, ampoule containing powder, sterile ampoule containing powder, so they will provide you either 2 ml, 5 ml, one small vial of your sterile water for injection. So before injection, what you will do, you have to break that ampoule. You have to use that sterile water for injection for reconstitution of that powder, and finally you have to make injection and then you have to inject them. Sterile water for injection is used for the single dose container reconstitution of sterile solid. Now bacteriostatic water for injection. So it is again prepared by distillation and reverse osmosis. Bacteriostatic water for injection. इसका endotoxin limit क्या है? 0.5 endotoxin per ml, not more than 0.5 endotoxin. So it is used for multi-dose container and single-dose product. Now what is difference between bacteriostatic water for injection and sterile water for injection? In case of water for injection, it is not sterile. Okay, immediately prepare करके आपको use करना है. Sterile water for injection मतलब क्या? ये स्टोर भी कर सकते हो आप बहुत टाइम तक, ठीक है, कोई दिक्कत नहीं. बैक्टीरियोस्टैटिक वाटर फॉर इंजेक्शन मतलब इसमें क्या रहेगा? इसमें बैक्टीरियोस्टैटिक एजेंट रहेगा. So इसमें बैक्टीरियोस्टैटिक मींस प्रिजर्वेटिव रहेगा. And sterile water for irrigation. So irrigation means washing. So if you want to wash internal organ, so you cannot use normal water. You cannot use your whatever. You cannot use a disinfectant extra. So what you have to use? Sterile water for irrigation. It is again prepared by distillation and reverse osmosis. Endotoxin limit is a 0.25 endotoxin unit per ml. It should be labeled as a irrigation purpose only. तो इसे इसका जो कंटेनर आता है उसके कंटेनर के ऊपर एक लेबल होना चाहिए. क्या? should be labeled as a for irrigation purpose only. नहीं तो इसको ये इंजेक्शन में डालेंगे. Sterile water for irrigation. Next one is a sterile water for inhalation. So it is again prepared by distillation and reverse osmosis. So it should have endotoxin limit of 0.5 endotoxin unit per ml. It is used for inhalation therapy only. मतलब क्या? आपने देखा होगा किसी को कोणी लहान मुलांना सर्दी वगैरे झाली तर डॉक्टरकडे घेऊन जातो आणि त्याला वाफ देतात. So by using that vaporizer or by using that, so in that they used to use some solution like sulfatamol solution or 0.9% sodium chloride solution and all that. Along with that, sterile water is used. Sterile water for inhalation. That is used for only inhalation therapy. Now water for hemolysis. Water for hemodialysis, not hemolysis. Hemodialysis मतलब क्या? ब्लड को साफ करने के लिए. आप बोलेंगे ब्लड कैसे साफ करेंगे? निकाल के साफ करेंगे. वाटर फॉर हेमोडायलिसिस. डायलिसिस जो होता है ब्लड का, डायलिसिस मतलब जो रिमूवल होता है टॉक्सिक कंपोनेंट जिनका किडनी फेल हुआ है. So those who are having kidney fail or those who are not efficiently filtering the toxic metabolite from body via kidney. So in that case you have to do hemolysis. Dialysis करना पड़ता है उनका. So in that case you have to use water for hemodialysis. It is prepared by again distillation and reverse osmosis. So endotoxin limit is a 2 endotoxin unit per ml. It is a drinking water for patient undergoing hemodialysis. So this is very important again. So ये water for hemodialysis मतलब वो किसके लिए है कि जो डायलिसिस की पेशेंट है उनको पीने के लिए वाटर रहता है. तो ये हीमोडायलिसिस वाटर मतलब इसमें बाकी कुछ भी कंटेंट नहीं रहेगा, पूरा प्यूरिफाइड वाटर रहेगा. सो दिस चार्ट इज वेरी इंपॉर्टेंट, बुक में दिया है. नेक्स्ट इज नथिंग बट द एक्सिपिएंट यूज्ड इन द commercial parenteral product. So along with your drug, along with vehicle, so you are using some excipient over here. So what are the excipients? Okay, we'll see what kind of different type of additives, what kind of different type of diluent, what kind of different type of antibacterial agent, what kind of different preservative, what kind of that stabilizers, okay, chelating agent, antioxidants they are used. So here name of that excipient and concentration. So पहले antimicrobial or preservative, antimicrobial agent or preservative. So remember, antimicrobial agent or preservative they are only added in the multi-dose container. जैसे vial होता है आपको vials, they are not added in the single dose container. Large volume parenterals they are not added. इसके ऊपर क्वेश्चन दो बार आ चुका है. So added antimicrobial or preservative they are added in the multiple dose vials, and are often included in the formulation to be sterilized by marginal process or made by aseptic manipulation. मतलब जहाँ पे कोई contamination का सवाल आता है हो सकता है उसमें क्या है, उस फॉर्मुलेशन में आपको एंटी माइक्रोबियल और प्रिजर्वेटिव ऐड करना है. जैसे मैंने बोला है कि वाइल्स में क्या होता है कि 30 ml 40 ml 50 ml सॉल्यूशन रहता है इंजेक्शन का. सो यू कैन नॉट इंजेक्ट 30-40 ml. So you have to withdraw frequently. Withdraw 2 ml, inject the patient. If another patient comes after 10 days, you have to withdraw that injection again and inject that patient. So in between that time, what will happen? There might be chances of getting contaminated. Only for chances, you are using this antimicrobial preservative. Okay, and remember it is only included in the multi-dose container, not in a single dose container or not in a large volume parenteral. GPAT में क्वेश्चन आ चुका है, कंफ्यूज होता है आपको. यहाँ पे फिर से एक बार मैंने बोला है, नोट कौन सा नोट गए, 100 या 100 रुपीज का 50 रुपीज का नहीं. Antibacterial substances are not used in the large volume parenterals and single dose container. Now what are the example? First one is a benzalkonium chloride. Concentration क्या है 0.01% weight by volume. Concentration भी याद रखो, क्वेश्चन आता है इसको. Benzalkonium chloride. Okay, then methyl paraben. It is used in the concentration, methyl paraben, propyl paraben is used in the concentration of 0.001 to 0.018. Then myristil gamma picolinium chloride. Myristil gamma picolinium chloride. Myristil gamma picolinium chloride. So it is used in the percent of 0.17. So remember इसके ऊपर एक बार क्वेश्चन आया था. So myristil gamma picolinium chloride is used as a dash in the parenteral preparation. It is used as a antimicrobial or preservative. Then phenyl mercuric nitrate 0.001%. Propyl paraben 0.005 to 0.035%. Phenol is used in the concentration of 0.065 to 0.5%. 0.065 to 0.05%. So these are the preservative. Now again you can see over here another additives. Solubilizers, wetting agent and emulsifiers. So solubilizer कब use करेंगे? When you use solubilizer, so if your drug is poorly soluble in this vehicle, then at that time you have to use solubilizer. Wetting agent means if your drug is poorly wetting, so wetting agent you have to use. Emulsifier, okay, again to increase the solubility and therefore act as a co-solvent or wetting agent or solubilizing agent. So what are the examples? So first one is a dimethyl acetamide used in the concentration of 0.1%. Dioctyl sodium sulfosuccinate 0.0015%. Glycerin 14.6 to 25%. Polysorbate 20 0.01%. Polysorbate 40 0.01%. Polysorbate 80 0.5%. Propylene glycol, okay, so it is used as a solubilizer in a 0.01 to 0.001 to 0.05%. Then buffers. What is the role of buffer? What is buffer? Buffer is nothing but the बफर कंसिस्ट ऑफ सॉल्ट ऑफ वीक एसिड एंड इट्स कॉन्जुगेट बेस। बफर में क्या होता है कि सॉल्ट ऑफ वीक एसिड एंड इट्स कॉन्जुगेट बेस। एस्कॉर्बिक एंड सोडियम एस्कॉर्बेट बफर, बोरिक एसिड एंड सोडियम बोरेट बफर। बफर का रोल क्या है? दे विल रेजिस्ट द चेंज इन द पीएच, पीएच का चेंज कम करेगी इन अ स्मॉल रेंज। ऐसा नहीं कि बहुत सारा ऐड किया तो पीएच चेंज होगा ही। दे विल रेजिस्ट टू चेंज इन द पीएच upon addition of small quantity of weak acid or weak base, that is known as a buffers. So actually it is a part of your inorganic chemistry, but still I am explaining here. Okay? So they are used to maintain the pH. Alteration in pH significantly causes the destruction or degradative reaction. तो अगर फॉर्मुलेशन का ऑप्टिमम पीएच है आपका कोई, उस पीएच में अगर चेंज होगा तो क्या होगा? डिग्रेडेशन होगा आपके ड्रग का या फिर डिस्ट्रक्टिव रिएक्शन आ जाएगा। टू प्रिवेंट दैट बफर्स आर यूज्ड। ओके, सो व्हाट काइंड ऑफ बफर्स आर यूज्ड? एग्जांपल बेंजोइक एसिड एंड सोडियम बेंजोएट बफर, so which are used to maintain the pH in concentration of sodium citrate buffer used in the concentration of 4%. Sodium bicarbonate is used in the 0.005%. Now bulking substances or tonicity modifier. Again another kind of additives used in the parenteral product. तो इसमें बल्किंग एजेंट, अगर आपका कोई इंजेक्शन जो है आपका एपीआई बहुत ही कम है तो उसको बल्कनेस इंक्रीज करने के लिए बल्किंग एजेंट यूज करते हैं। टोनिसिटी मॉडिफायर मींस make your solution of injection isotonic with your blood plasma. They will contribute the isotonicity as well as they will reduce the pain at the site of injection. Now glycerin is used in a concentration of 1.6 to 2.25%. Lactose, mannitol, dextrose, they are used in the concentration of 1.6 to 1.6 to 2.25, 0.14 to 5, 3.75 to 5. Then sodium chloride, ये चार्ट as it is लैकमन में भी दिया है। Sodium chloride is used in a varying proportion to increase the bulkness for isotonicity 0.9% sodium chloride per volume. Now suspending agents. If you want to prepare a suspension of injection, so what kind of agent are used? So gelatin and methyl cellulose, they are used in the concentration of 2% to 2%. Gelatin is used in the concentration of 2% and methyl cellulose 0.03 to 1.05%. Polyethylene glycol 4000 and sodium carboxymethyl cellulose, they are used in this concentration respectively. The concentration is not important. Chelating agent means what? They chelate the oxidizing agent. Chelating agent means they are used to chelate the oxidizing agent. अगर कोई ऑक्सीडेंट है आपके फॉर्मुलेशन में तो ऑक्सीडेशन कर देगा आपका प्रोडक्ट का। तो टू प्रिवेंट दैट चिलेटिंग एजेंट्स आर यूज्ड। तो सोडियम इडिटेट, डाइसोडियम कैल्शियम इडिटेट, they are used in this concentration. Now next one is stabilizer. So creatinine, glycerin, niacinamide, these three are used as a stabilizer. Concentration of not important. Then local anesthetic like benzoyl alcohol and procaine hydrochloride. Benzyl alcohol, procaine hydrochloride, they are also added in the injection to prevent the pain. Okay, in a okay, in a 5 and 1% respectively. So benzoyl alcohol used in the 5% weight by weight is procaine 1% in the injection to prevent the pain. Now antioxidants, again it is a very important part. इसके ऊपर भी कम से कम 2-4 बार क्वेश्चन आ चुके हैं। So antioxidants, what do you mean by antioxidants? So these are the agents which will prevent the oxidation of your product. कि आपके प्रोडक्ट में ऑक्सीडेशन हो रहा है तो उसको प्रिवेंट करें। एंटीऑक्सीडेंट्स, एंटी मतलब ऑपोजिट, ऑक्सीडेंट मतलब ऑक्सीडेशन के ऑपोजिट। सो दे आर यूज्ड इन द पेरेंटल प्रिपरेशन, दे आर यूज्ड टू प्रोटेक्ट द थेरेपेटिक एजेंट लायबल फॉर ऑक्सीडेशन। अगर आपके ड्रग का ऑक्सीडेशन हो रहा है, आपका ड्रग अगर ऑक्सीडेशन के लिए प्रोवन है, so in that case you have to use antioxidant. So particularly at accelerated condition, मतलब आपका स्टोरेज टेम्परेचर अगर बढ़ गया तो उसमें ऑक्सीडेशन हो सकता है। ओके, सो टू प्रिवेंट